Have you ever noticed how some things, well, they look simple on the surface, don't they? Like a cow just grazing peacefully. But underneath, there's this whole hidden world of complexity. We've all been there, right? Trying to figure out software or maybe even a recipe that looks easy. Well, today we're taking one of those surprisingly nuanced topics and doing a deep dive: nervous system trauma in cattle.
Yeah, and it's fascinating because these conditions pop up quite often, actually. And they
Yes.
can be incredibly critical, really debilitating for the animal. We're talking about a huge range here from, minor things that clear up to really severe life-changing injuries. They affect how an animal moves, feels, everything.
Exactly. So, our mission today is to give you, our listener, a really solid but concise understanding of this pretty complex area. We'll break down the main injury types, the signs to look for, how vets diagnose and treat them, and importantly, how that comprehensive care can make such a difference. Think of it as your shortcut, really, to getting up to speed on this vital corner of veterinary medicine.
And just so you know, we're drawing on a lot of solid veterinary research here, plus real-world clinical insights to give you the best possible picture.
Okay, let's dive in then. When we say nervous system trauma in cattle, what exactly are we talking about?
So at its heart, it's physical damage.
Yeah.
It could be to the peripheral nerves, those are the ones branching out, like wires going to the limbs, or it could be the spinal cord, the main info highway, or even the brain itself. And the result, well, it messes with motor function or sensory perception, sometimes both. It's a really broad spectrum.
That does sound broad. So if a nerve gets damaged, is it always like really bad, or are there different levels we should understand?
Oh, definitely different levels. It's not all the same. And knowing the difference is key for figuring out recovery chances.
Hmm.
The mildest form, that's called neuropraxia. Think of it like a temporary kink in a garden hose. Yeah. Water flow's messed up for a bit, but the hose isn't actually broken. Nerve conduction gets interrupted, but there's no real structural damage. Function is impaired, sure, but you usually see complete recovery, often within about 3 weeks. It's kind of the best case scenario.
Right, a temporary glitch, basically. So they bounce back fairly quickly. What if the damage is more serious than that?
Then you're looking at axonotmesis. This is where the actual nerve fibers inside the wires in the cable, if you like, they're disrupted, but the outer layers, the connective tissue around them, that's still intact.
Ah, okay. So the insulation's still there, but the wires inside are frayed.
Pretty much. And recovery here means those nerve fibers have to regrow. That's slow work, maybe 1 to 3 millimeters per day. So the prognosis, well, it really hangs on how far that nerve needs to regrow and if that protective sheath is still good enough to guide it.
A slow process then, dependent on distance? And the worst case scenario?
That would be neuromesis.
Yeah.
This is a complete cut. The nerve
Yeah.
is severed all the way through, including all the connective tissue. Yeah, it's like snipping an electrical cable clean in half. Without surgery to line up the ends, recovery is really unlikely. The nerve just has nowhere to go.
That paints a very clear picture. So we've got these levels of damage. How do these injuries actually happen to cattle? What are the usual suspects?
Well, there are several common ways. A really major one is complications around birth periparturient complications, difficult births, or dystocia, as vets call it.
Yeah.
That's a huge cause of nerves getting compressed or stretched, both for the calf and the mother, especially around her pelvis.
Yeah, I can definitely see how the sheer forces involved in birth could pinch or stretch things.
Absolutely. Then there's just plain direct trauma, physical hits, falls, maybe getting struck by something. Cattle have accidents, slipping, falling, banging into equipment.
Sure. And you hear a lot about prolonged recumbency, cows being down for too long. How does just lying down cause nerve damage?
That's a critical one. If they're down for extended periods, especially on hard surfaces like concrete, the pressure alone can cause severe nerve and muscle damage. It's a massive factor in what we call downer cow syndrome, where the cow stays down even after the initial problem, like maybe milk fever, is fixed. The pressure just cuts off blood flow.
Wow. And finally, you mentioned iatrogenic injury. That sounds preventable.
It means damage caused accidentally during medical treatment. A common example is nerve damage from an intramuscular injection, particularly to the sciatic nerve, if the needle isn't placed just right. Vets and farmers are usually very careful about that.
Got it. So those are the basics. Let's get into some specifics now, focusing on those peripheral nerve injuries. You said these often cause lameness or odd gaits. Let's start with the hind limbs pelvic limb paralysis, often linked to calving, you mentioned. First up, obturator nerve paralysis.
Yeah, this is super common after difficult births, especially in, say, smaller heifers having their first calf if the calf is quite large. The obturator nerve runs right through the pelvic canal, and it can just get crushed during delivery. A hip lock, where the calf's hips get stuck, that's a frequent cause.
And what does that look like? If you saw a cow with this, what would tip you off?
Well, if she's trying to stand, her hind legs will splay out really wide, almost like she's doing the splits.
Ah.
She might slip and fall easily,
Mm.
but more often she'll just be down recumbent with those hind legs kind of spread-eagled out to the sides. Can't get them underneath her. She'll usually be bright and alert, trying to get up on her front end, but that splaying, it can quickly lead to secondary damage.
Mm.
Torn adductor muscles, even dislocated hips.
That sounds awful and dangerous. How's it diagnosed, and what's the immediate fix?
Diagnosis is mostly based on that history just calved and the very distinct posture. Sometimes a vet might do a rectal exam to rule out a pelvic fracture just in case. Treatment-wise, hobbling those hind legs is absolutely crucial. It often saves their lives.
Hobbling.
Yeah, using a strap or rope to connect the hind legs, keeping them maybe no more than about 45 centimeters apart, stops that extreme splaying. The key thing here isn't just treating the splay itself, it's preventing those secondary injuries like hip dislocation. If that happens, it's often game over. So hobbling fast is vital economically too. And of course, good supportive care, soft bedding, rolling her regularly.
Okay, crucial first step. Next on the list for hind limbs. Sciatic nerve paralysis, also common after calving.
Yes, often damaged then too, particularly if one of the nerve roots coming off the lower spine gets compressed against the pelvis during birth. But it can also happen from pelvic fractures or, like we said, those misplaced injections, especially in young calves without much muscle mass back there. It's a big part of many downer cow cases.
And the signs for sciatic damage, what would you see in how the cow moves or stands?
Typically, you see a dropped hock. Basically, the main muscles that extend the hock joint are paralyzed, so the hock drops lower than normal. The animal might drag its foot, knuckle over under the top of its fetlock. Persistent knuckling, they can't really flex their stifle, hock, or digits properly. Interestingly, though, and this is a clue for vets, the patellar reflex, the knee-jerk reflex, might still be strong. That helps pinpoint it to the sciatic nerve. You might also see less tail tone, maybe problems urinating because the bladder's affected, and loss of feeling below the stifle.
Okay, moving down the list. Femoral nerve paralysis, what's the story there, especially in calves?
This one we see mostly in large newborn calves. It's usually caused by too much force, maybe excessive pulling during an assisted birth. That stretches or damages the femoral nerve. Hip lock or stifle lock during delivery can also be involved.
And how does that show up in the calf?
They'll have real trouble standing. Big problem, because they need to stand to suckle. The stifle joint, their knee, looks dropped because the big quadriceps muscles on the front of the thigh, which extend the stifle, are paralyzed. You'll see those muscles waste away atrophy really quickly within maybe 7 to 10 days. The key diagnostic sign is a weak or totally absent patellar reflex. If both legs are affected, the calf often sits in this characteristic dog-sitting posture.
That posture sounds like a clear sign. What about peroneal nerve injury?
Ah, the peroneal nerve. It runs down the outside of the hind leg, is pretty close to the surface, so it's vulnerable. Often gets damaged by direct bangs or pressure. Very common cause is prolonged lying on hard surfaces, like concrete again, think downer cow, especially if she also has low calcium, hypocalcemia, making her weak. Usually affects just one leg.
And the signs for peroneal?
You get paralysis of the muscles that flex the hock and extend the digits. So the animal stands with the foot knuckled over, resting on the front of the pastern or fetlock. The hock might look overextended. They often drag the top surface of their hoof, which can cause sores, abrasions.
Yeah, that could lead to infections. How's it treated?
Luckily, most of these are neuropraxia, that mild temporary damage, so they usually resolve with conservative care. Bandaging or maybe splinting the fetlock helps stop those abrasions from dragging and give some support.
Okay, and last one for the hind limbs. Tibial nerve injury, is this common?
The tibial nerve is pretty well protected deep inside the leg, so direct injury is rarer than the others. But it can happen, usually after a really long second-stage labor, if the calf is just too big and causes pressure deep inside. It sometimes gets confused with sciatic nerve damage because some signs overlap.
So what are the signs that point specifically to tibial nerve trouble?
Paralysis of the muscles that extend the hock and flex the digits. So unlike the peroneal, the hock tends to be overflexed, that dropped hock look again, and the fetlock is partly flexed. The gait might look a bit better than with peroneal damage, but that posture change can sometimes be permanent, unfortunately.
Okay, we've covered the hind limbs pretty thoroughly. Let's shift gears to the forelimbs now. Radial nerve paralysis sounds important. What leads to that?
It is significant. Injury high up, near the shoulder, Proximal injury can happen if an animal gets tangled in ropes and struggles hard, stretching the nerve, or direct trauma to the shoulder. Also, prolonged lying on one side in heavy animals, that downer cow scenario again, or even a fractured rib near the nerve plexus. Injury lower down distal paralysis often happens from pressure when lying down, especially in big, heavy animals, because the nerve wraps around the humerus bone there and is vulnerable.
Lots of potential causes. What does it look like? How does the cow present?
With a high injury, the elbow drops noticeably. The carpus, wrist, and fetlock are partly flexed. The leg just gets dragged because they can't extend those joints to bear weight properly. If the injury is lower down, the elbow dropping is less obvious because the triceps muscle still works. They might be able to bear some weight if you place the foot right under them, but they still drag the leg, often scraping the front of the fetlock and hoof. And sensation is usually lost on the front part of the limb from the elbow down.
What's the outlook and treatment?
You hope for rapid improvement with anti-inflammatories and good nursing care. Confining them to a well-bedded stall, maybe bandaging the fetlock to prevent sores and infection, that's key. But if there's no improvement after about 2 weeks, the damage is probably permanent and the prognosis gets pretty poor.
Okay. And lastly, for the forelimbs, brachial plexus injury. What exactly is the brachial plexus and how does it get damaged?
The brachial plexus isn't a single nerve. It's more like a complex junction box of nerves. It's in the armpit area, where nerves from the neck and spine bundle together before heading down the forelimb. In calves, it can get injured, usually from pulling too hard during a difficult birth, especially if the cow lies down mid-delivery and the calf's shoulder gets yanked awkwardly. In adults, it involves damage to those nerve roots coming off the spine or the plexus itself. Leads to pretty severe paralysis of the whole forelimb.
And the signs? How would you know it's the brachial plexus?
It's usually quite dramatic in severe cases. Total inability to extend the elbow, wrist, or fetlock, can't bear any weight on that leg. You often see significant muscle wasting over the shoulder, so the spine of the shoulder blade really sticks out. Elbows dropped, lower joints are flexed, hoof scuffs the ground. Foot's usually knuckled over when resting. A complete lesion causes paralysis of the whole limb monoplegia, plus total loss of sensation below the elbow.
And the prognosis for something like that?
Very poor for neurological recovery. If those nerve roots have been completely torn away from the spinal cord, that's called avulsion. Not much chance of repair there.
Okay, we've gone through a lot on peripheral nerves. Let's move centrally now to the main communication line, the spinal cord. What causes trauma there in cattle?
Spinal cord injuries, well, they can happen in a few ways. Surprisingly, one common cause is being mounted or ridden by other animals. That can cause direct injury to the spine. Then there are accidents, slipping, falling, maybe getting trapped under or between things like gates or rails. That can lead to fractures or compression of the cord.
And I assume calving difficulties can impact the spine too.
Oh, yes. Dystocia can cause vertebral fractures in the calf or something called myelomalacia, that's softening and damage to the cord tissue itself or just compression. These are especially risky if the cow goes down suddenly during birth, particularly if she's confined, maybe in handling stocks.
So if the spinal cord is hit, what signs tell you where the damage might be along that central highway?
Signs depend a lot on where the injury is and how bad it is. Knuckling is a common one. Flexing that fetlock joint forward, walking on the front of the pastern, can be partial, just touching the front, or really extreme. Often happens in both hind limbs if the injury's in the back. You'll also see general weakness and ataxia that's in coordination. They look wobbly, weak on all fours, maybe stumble.
Are there other clues, maybe involving the tail or reflexes?
Yeah, definitely. You might see changes in tail tone. It could be weak or totally floppy. The anal reflex might be absent too. Important note, though. Knuckling isn't only caused by spinal trauma. Some diseases can cause it too, like rabies or certain infections. So vets have to rule those out.
How do you diagnose spinal cord trauma then? How do you pinpoint the location?
The neurologic exam is really the cornerstone. It's a careful check of posture, how they walk, their spinal reflexes, checking for pain sensation both superficial and deep, and looking at muscle size. Muscle wasting, atrophy for nerve damage can happen surprisingly fast, sometimes in just days, which is another clue.
And imaging, can you actually see the damage?
X-rays, radiography, are crucial first, especially to check for unstable fractures before you move the animal around too much, which could make things worse. For more detail, advanced imaging like CT scans is really helpful for looking at acute injuries and finding areas where the cord might be getting squeezed or compressed. MRI is also great for that, especially in young animals with potential birth defects causing compression.
Okay, once you have a diagnosis, what's the treatment plan? Is it medical or surgical?
It's often a combination, really depends on the severity. If there's just pain or mild deficits, medical management might be enough. That means strict stall rest could be 2 weeks, could be 6, plus anti-inflammatory drugs
Yeah.
like dexamethasone or flunixin and painkillers.
And when does surgery come into play for spinal injuries?
Surgery for decompression or stabilization is usually needed if there's significant instability, like a dislocated joint, luxation, or a bad fracture. Also, if there are severe neurological problems or clear evidence of something pressing hard on the cord from the outside. If a nerve seems sharply cut, prompt surgery is best. Sometimes surgeons might explore a blunt injury site later to remove scar tissue if it's causing ongoing compression.
And beyond drugs and surgery, that supportive care must be absolutely essential, right? Especially if they can't move well.
Oh, massively vital. Rest on a non-slip surface is critical to prevent more falls. Bandaging or splinting those knuckling fetlocks can help them stand and walk better and stops them getting scraped up. Physical therapy, like passive range of motion exercises, is really important to stop muscles wasting and joints seizing up. And you have to watch out for self-mutilation. Sometimes, because of weird sensations, pins and needles, what vets call paresthesia or loss of feeling, they might chew on their limbs. Medications can sometimes help manage that sensation.
What's the general outlook, the prognosis for spinal cord trauma?
Honestly, it's generally guarded. It really depends. Animals with significant problems but intact, deep pain sensation, meaning they can still feel strong pinching, tend to do better, especially if surgery can stabilize things. But losing that deep pain sensation, that's a bad sign, suggests very severe damage. Remember, nerves heal incredibly slowly, maybe an inch a month. So recovery takes time, weeks or months. If you see improvement in movement, feeling, and reflexes within the first month or two, that's generally a good sign. But if there's no change after a couple of weeks, the damage is likely permanent. And complete tearing of nerve roots, very poor prognosis.
Right. Okay, let's move up to the control center now. Head trauma, injuries to the brain. What typically causes those in cattle?
Various things, unfortunately. Falls from a height, sometimes gunshot wounds, bites from predators or other animals, and sadly, sometimes accidents involving humans or even purposeful attacks. Traumatic brain injury, or TBI, is pretty common in these situations.
And the signs must be incredibly varied, given how complex the brain is.
Hugely variable, yes. Depends completely on which part of the brain is hit and how badly. You can see anything from mild signs, maybe they seem a bit off, disoriented, altered mentation, or unsteady ataxia, right up to severe stuff like profound weakness or seizures.
Yeah.
You can also get complications like neurogenic pulmonary edema, that's fluid in the lungs caused by the brain injury, comes on fast, causes severe breathing trouble, low oxygen. Other signs might include a high temperature, weird muzzle tremors, odd postures, not wanting to eat, maybe holding their head extended.
A wide range of worrying signs. How do you approach diagnosis when time is so critical with head injuries?
First things first, assess overall stability, the ABCs, airway, breathing, circulation, you have to check those immediately. Low blood pressure, hypotension, and low oxygen, hypoxemia, are really bad news. They strongly correlate with increased pressure inside the skull, intracranial pressure, or ICP, and higher risk of death. So you tackle those first. Then a detailed neurologic exam is key to try and pinpoint where in the brain the injury might be.
And imaging the brain itself, can you see the damage?
CT scans are really the gold standard for severe cases. They show fractures clearly, any bruising or bleeding in the brain tissue, blood clots. And crucially, signs of brain herniation, where swelling pushes brain tissue out of place. That's an emergency. Regular skull x-rays. They aren't great for ruling out fractures and just don't show the brain tissue detail you need.
So treatment sounds like it needs to be fast and furious. What's the main goal?
The absolute main goal is to minimize secondary brain injury, that's damage that happens after the initial hit, often from swelling, lack of oxygen, or poor blood flow, and to keep that intracranial pressure down. Emergency treatment starts with life-threatening stuff, securing the airway, ensuring breathing, supporting circulation. Correcting low blood volume or pressure is vital to keep blood flowing to the brain. Often start with hypertonic saline salty fluid, which pulls fluid out of the brain quickly, helping lower pressure, followed by other fluids.
What about oxygen specifically?
Anything to improve oxygen levels is good. If they're really struggling to breathe, they might need intubation, a breathing tube, and ventilation support. To lower ICP, keep the head elevated maybe 30 degrees, make sure there are no tight collars pressing on the neck veins, and use those hyperosmolar drugs like mannitol or hypertonic saline to draw fluid out of the brain.
Any other specific medications used?
Anti-inflammatories are sometimes used, but their benefit is a bit debated in TBI. Pain relief and light sedation are important to keep the animal calm, as stress can raise ICP. Anticonvulsants if there are seizures, antibiotics, especially if there are open wounds. And good nutritional support is really important for recovery. If there's a blood clot or a skull fracture pressing on the brain or foreign material in there, then decompressive surgery might be needed to relieve that pressure.
What's the prognosis usually like for head trauma?
Mild and moderate injuries often have a surprisingly good recovery rate. But things like high blood sugar, low blood volume, or a really low score on coma scales, those are bad signs. The key takeaway is that early aggressive therapy dramatically improves the chances. That initial window is critical.
Okay, we've covered specific peripheral, spinal, and head injuries. Let's tie things together now with general management, especially focusing on that Downer cow syndrome you mentioned. Can you recap what that is and why it's such a challenge?
Right, the downer cow is basically a cow that stays down, unable to stand even after you've fixed the original problem, like maybe the milk fever is treated, but she still won't get up. And often that's because of that devastating secondary muscle and nerve damage from the pressure of lying down too long, especially on hard surfaces. It's like a vicious cycle, and managing it effectively is key to breaking that cycle.
So if you find a cow down like that, what's the absolute first thing you do? How do you stabilize her?
Treat it like an emergency. Assess her quickly. Are there severe injuries that mean, realistically, euthanasia is the kindest option? You have to consider that. But if there's a chance, the very first thing is to get her rolled onto her chest into sternal recumbency and propped up there immediately. This stops bloat, it takes pressure off nerves and muscles on the downside, helps her breathe easier. It's vital. And if you have to move her, use a sled or a proper hoist. Never, ever drag her by a leg or her head. That can cause terrible extra damage.
And the environment she's in, how important is that?
Oh, environmental management is huge. Get her into a dry, really softly bedded stall if possible. Sand is fantastic, ideally deep, like 10 inches or more. It cushions, it drains well, stays cleaner. Concrete is the worst. No cushioning at all. Needs shelter too, and regular mucking out to keep things clean and dry prevents skin scald and other infections.
Nutrition and fluids must be tricky if they can't get up to eat or drink.
Absolutely critical. Make sure fresh food and water are right there within easy reach, maybe in shallow pans near her head. If she's not drinking, she needs fluids, maybe drenched, maybe IV to prevent dehydration. And if she had low calcium initially, keep monitoring other minerals too. Phosphorus, magnesium, potassium might need supplementing those as well.
Okay, now the really interesting part. Assisted standing and mobility aids. Getting them up early is key, you said.
It's incredibly important. The sooner they stand, even for short periods, the better their chances. It relieves that constant pressure. Simple things can help. A tail lift, just having someone gently lift at the base of the tail, can provide a bit of stability. Or knee stimulation, a vet might use their knees to push into the muscles below the shoulder blade to encourage rising.
What about things like hip clamps? Do they work?
Hip clamps. They can work, but you need to know what you're doing. They shouldn't be left on continuously because they can cause pain and tissue damage. Need rubber lining, not too tight. Honestly, for consistent success, especially with bigger animals, a proper canvas sling that goes under the chest, supported by a hoist or loader, that's almost essential. It lifts them safely.
And you mentioned flotation tanks earlier. They sound amazing. How do they work?
They really are amazing. Flotation tanks use water buoyancy to support the cow's weight. She can stand, move her legs freely, regain strength, improve circulation, all without the full stress of gravity on damaged limbs. Often cows that just cannot stand even in a sling, they'll stand quite comfortably in neck-deep water for hours. The success rates are really impressive, around 55% overall get-up, and maybe as high as 80% if the initial injury wasn't something catastrophic like a bad fracture. It's a fantastic tool.
That's incredible technology. Any other, maybe lower-tech tricks to get them motivated?
Sometimes, yeah. Startling them slightly loud noise, stomping, can trigger that instinct to jump up. Temporarily blocking their nostrils can sometimes do it too. If for a cow that's just calved, sometimes just having her calf nearby, maybe where she can hear it but not see it easily, gives her a powerful reason to try and stand.
So, besides getting them up and comfortable, preventing those secondary complications must be a huge focus for downer cows. What are the big risks?
Absolutely. Those complications can easily become life-threatening. Pressure sores and that ongoing muscle and nerve damage from pressure, huge concerns. That's why rolling them side to side multiple times a day, at least 3, is so critical. Keep the circulation going, change the pressure points.
And infection risk must be high too.
Very high. Mastitis, uterine infections, metritis, they're prone because they're often lying in soiled bedding. Cleanliness is paramount.
Yeah.
You also have to fight muscle wasting, atrophy, and stiff joints contractures. That means daily passive range of motion exercises, gently flexing and extending their limbs for them. Physical therapy, basically.
And preventing them hurting themselves if they can't feel properly.
Right, that self-mutilation risk.
Yeah.
If they have weird sensations or no pain, they might chew or damage a limb without realizing. So bandages, splints, even casts might be needed for protection. And for those cows doing the splits, the obturator nerve cases, hobbling is vital, like we said. Keep those hind legs maybe 24-30 inches apart with wide, soft hobbles. Check them often to make sure they're not rubbing. Prevents those devastating hip dislocations or muscle tears.
Okay, so that's managing the down cow, but what about preventing these injuries happening in the first place? Any general advice?
Yeah, prevention's always better. Using low-stress handling techniques is key. Calm handling during procedures, transport reduces panic and falls. Good environmental management, safe footing, maybe rubber mats in key areas, getting rid of hazards in barns or yards, using proper restraint for procedures so they don't struggle excessively and injure themselves, and careful calving management, getting help early for difficult births, reduces the risk of pulling too hard and injuring the calf.
Wow. Okay, this deep dive has really opened my eyes to just how varied and complex nervous system trauma in cattle is. I mean, from neuropraxia, that temporary thing, right up to severe brain injuries. It's a huge range.
It really is. And I think what comes through so clearly is how vital accurate diagnosis is. Getting in there early with treatment, and especially that dedicated, often intensive, comprehensive, supportive care afterwards. It's often not just fixing the initial problem, but nursing the whole animal through a long recovery.
Absolutely. And understanding all this, the specific conditions, the management, it really highlights the complex needs these animals have and the dedication it takes to care for them properly. It's not
Yeah.
just info for vets, you know. It helps all of us appreciate that balance of health and just how much difference good, diligent care makes.
And that leads to a really interesting thought, doesn't it? When you think about advancements like those flotation tanks we talked about, or better imaging, they're genuinely changing the game, giving hope for animals that maybe even a decade ago would have been considered hopeless cases. So what does that tell us about where animal welfare is heading? And you have to wonder, what other seemingly unsolvable problems in animal health are maybe just waiting for the next breakthrough?